Hello, I am Dr. Mazza, and I would like to talk to you today about when cancer treatment can affect your heart. Cardiovascular diseases are the leading non-cancer cause of death among the 18 million cancer survivors in America. This means that you can beat cancer and still lose your heart in the process. I am Dr. Mazza. I practice in Palm Beach, and I have seen more than once problems that arise when the systems don't talk to each other. Most oncologists correctly focus on killing the cancer, but certain chemotherapy drugs, targeted therapies, and chest radiation can silently damage your heart during treatment and sometimes years later. So today I want to discuss with you when cancer treatment can affect your heart, who is at the highest risk, and what you can do to protect yourself before, during, and after therapy. Here is what most patients don't realize. Certain chemotherapy drugs, especially a class called anthracyclines, like doxorubicin, can weaken the heart muscle itself. Targeted therapies can interfere with pathways your heart cells need to survive. Radiation to the chest can cause scarring or thickening of the heart valves and the coronary arteries. Some of the newer immunotherapies can trigger inflammation of the heart muscle, which is rare but can be even life-threatening when it happens. These therapies can save lives. The issue is not the treatment itself. The issue is the gap in monitoring and coordination between oncology and cardiology. Most patients are never told to get a baseline echocardiogram before starting chemotherapy. So there is no reference point if the heart function declines later. The symptoms can show up during treatment or even years after you have been declared cancer-free. Symptoms can be shortness of breath, swelling in your legs, chest discomfort, palpitations, fatigue that feels different from the normal cancer chemotherapy-related fatigue. The reason this happens is a system design problem. Oncologists are correctly focusing on killing the cancer, which is exactly what they are supposed to be doing. But many times, the cardiologists should also be part of the team. Your heart needs active protection. Many hospitals nowadays have teams which are called cardio-oncology programs, where oncologists and cardiologists work together to monitor the patients before, during, and after cancer therapy. But this is still emerging. Most community practices do not have it. If you are being treated outside a major academic center, you may need to advocate for yourself. Before starting cancer treatment, there is some good questions that you should ask your oncologist. For example, do I need a baseline echocardiogram? Is there any cardiovascular concerns with the planned chemotherapy? Which of my cancer drugs carry cardiac risk? And who will be monitoring my heart function during treatment? If your oncologist doesn't have a cardio-oncology relationship, ask for a referral to a cardiologist who understands cancer-related heart toxicity. If you are already on treatment or you are a survivor, schedule a cardiac evaluation even if you feel fine. Damage can be silent. There are certain risk factors which would favor to have a cardiologist on your cancer team from day one, not after your heart starts failing. The patients that are at higher risk of cardiotoxicity from cancer treatment are those with prior heart disease, diabetes, high blood pressure, high cholesterol, smoking history, older age, or previous chest radiation. If you already had a heart attack, atrial fibrillation, heart failure, and now you're facing cancer, the chemotherapy or radiation can accelerate the cardiac damage you already have. If you are diabetic or hypertensive, your blood vessels are already under strain, Adding cardiotoxic chemotherapy multiplies the risk. If you had chest radiation for a prior cancer like breast cancer or lymphoma, and now you need treatment again, your heart may already have a structural damage from the first round. The reason this matters so much is timing. If you start chemotherapy without knowing you have high risk and your heart function drops during treatment, your oncologist may have to reduce doses, delay cycles, or even stop therapy altogether. That can compromise your cancer cure. But if a cardiologist evaluates you before treatment, they can put protective medications in place like ACE inhibitors or beta blockers. Monitor closely and catch problems before and when they are still reversible. This is the difference between finishing your cancer treatment successfully and having to choose between your heart and your survival. If any of the high-risk factors apply to you, insist on seeing a cardiologist before starting cancer therapy. Bring a list of your cardiac history. Bring a list of your medications and prior imaging, echoes, stress tests, catheterization to your oncology consult. Ask, given my cardiac history, what medications can we start now to protect my heart during chemotherapy? If you already are in treatment and you have any of these risk factors, but no cardiologist involved, get one now. It is not too late. The earlier you catch heart damage from cancer treatment, the more reversible it will be, which is why monitoring matters more than the drug itself. Doctors may recommend echocardiograms to check heart function at baseline, mid-treatment, and post-treatment. Blood pressure monitoring becomes critical because some cancer drugs, like VEGF inhibitors, can spike blood pressure suddenly. Cholesterol management continues through treatment because chemotherapy can worsen lipid profiles. Exercise and heart-healthy nutrition are not paused during cancer treatment. Patients who stay active have better cardiac and cancer outcomes. Medications that help protect the heart, like ACE inhibitors, beta blockers, statins, may be started even if you do not have symptoms, just as a preventative shield. The deeper principle here is that heart protection isn't something you do after cancer treatment. It is something you do during, when the damage is happening. If you wait until you are short of breath or swollen to get an echocardiogram, your ejection fraction may have already dropped from 60% to 35%, and now you are at risk of heart failure. But if you catch it at 55%, you can adjust medications, adjust chemotherapy doses, and prevent permanent damage. This is why continuity matters. If you're seeing a different provider every visit, no one's tracking the trend. They are just reacting to the snapshot. If you are in active cancer treatment, make sure you're getting echocardiograms at regular intervals, typically every 3 months during high-risk chemotherapy. Report symptoms early: shortness of breath, swelling in the legs, chest discomfort, palpitations, unusual fatigue. Don't assume it's just the chemotherapy making you tired. Ask your cardiologist, am I on any protective medication for my heart right now? Should I be? Keep a simple log of your blood pressure if you are on targeted therapy. It can spike suddenly and need to be cut fast. Stay physically active during treatment if your oncologist clears you. Even walking 20 minutes a day improves cardiac resilience. The message I want everybody to remember is this: you do not have to choose between treating cancer and protecting your heart. With modern monitoring and teamwork, we can care for both. Beating cancer is a massive victory. Let's make sure that you have a strong, healthy heart to enjoy everything that comes next. If you or a loved one are preparing for treatment, currently in the thick of it, or navigating life as a survivor, here in South Florida, you don't have to guess about your cardiac health. At CardioCare Palm Beach, we are here to partner with your oncology team and build your protective shield. This is Dr. Mazza from CardioCare Palm Beach.